Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and healthcare professionals discussing health topics of importance to you and your family. Today, our show features a tour of Brunswick Novant's rehab services. So come on inside and let's look around.
Hi, June. Welcome to Cardiac Pulmonary Rehab. It's great to have you here.
It's so nice to be here, Kim. It's a pleasure. Thank you for having us.
Oh, you're welcome. You're welcome.
Tell me what you do here at Cardiac Pulmonary Rehab.
Well, I'm a registered nurse, and I have an advanced cardiac life support certification. I monitor patients who have come into us who have been referred from Wilmington, who've had interventions or heart attacks, some kind of heart problem, and they've had an intervention.
Well, great.
Would you like to see the facility?
I would love to. That's what it's all about.
Okay.
Wow, this is a busy place, Kim.
It is. This is it. This is all of our patients exercising. And all of our
So
equipment.
you have a number of different machines.
We do. We have quite a bit of variety here. We don't want the patients to get bored, so we usually have them do a couple of minutes on each piece of equipment so that they're not bored. They exercise for a total of about 45 minutes. They start at a lower amount and then work their way up.
45 minutes?
Total exercise.
And how many days a week would that be?
It's 3 days a week. It's prescribed by the doctors 3 days a week. They start out with about 30 minutes of exercise and work their way up, and then we slowly increase the intensity so that they're working at a pretty maximum level, heart level.
And then are they monitored throughout this?
Yes, these are all patients who have had some kind of intervention. They've either had a heart attack, or they've had a stent put in, or an angioplasty, or they've had bypass surgery, or they've had a valve replacement or a repair. And they're all monitored for 36 sessions. The insurance will pay for up to 36 sessions. The doctors prescribe 36 sessions.
Yeah, I was going to ask you about that. So most insurance carriers cover this?
Yes, it is covered by insurance for 36 sessions.
And would there be a reason why they would have to continue, maybe for additional
sessions? There is a approximate time that we do recommend that they continue in maintenance. We say for about a month or so. They might want to continue here so they can get independent doing their own exercise. And then we recommend that they go to a gym or do exercise at home, or they use a facility that's near their home.
Well, I noticed that there's a variety of equipment here. I wonder if you could talk a little bit about the various types of machines.
Sure. There's probably 4 or 5 modalities that we usually recommend patients use. One is weight bearing, which is a treadmill. Obviously, it's a walking machine. This is called the new step, where they utilize both arms and legs to work up their heart rates. There's a recumbent bike back there, which nobody happens to be on, but it's actually a sitting position bike. And then there's an Airdyne, which one of our patients is on, which is this one right here. And they sit and they actually pedal a bike and use their arms. So a lot of the mechanisms are for arm and leg use also, which gets their heart rates up, exercises the entire body.
Oh, what about this?
We have a rowing machine.
Oh, it's a rowing machine.
This is a rowing machine. We also have an elliptical machine in the back, and we have a back-to-weight machine. And usually after the patients have been here, probably 12 to 14 sessions, we'll start them on weights, some light weights.
And who designs the program that the patient will follow?
With sort of a combination of people. We have an exercise physiologist who's right over here, Keith, and then the nurses too. So we all do a little designing as far as
so the doctor just sort of writes an order for them to have cardiac rehab, and then the team here designates what
we do have the patients come in for an orientation program where they do a 6-minute walk test, and we sort of can determine at that point in time what their starting level is, how deconditioned they are, how conditioned they are, looking at their monitor, monitoring their vital signs, and then we sort of determine where to start them and how to progress them.
So it all starts, though, with the physician writing an order, and then they come to rehab. And it doesn't matter where they got their surgery or where they received their care?
Most of our patients are referred from Wilmington. Obviously, that's the closest hospital where they do interventional cardiology.
Right.
We also have some referrals from Grand Strand. We've had some from Loris. So we've had plenty from Duke, a lot of people from Duke who are Brunswick County residents who have their surgeries at Duke or UNC, and they're referred here for their cardiac rehab.
Oh, that's good to know. So it's very convenient for the folks in Brunswick County then to receive their rehab here at home.
There's no reason for them to leave the county to get their rehab services here.
That's awesome. That's awesome. Well, I bet you have some success stories.
We have some wonderful success stories, and actually one of our patients is getting ready to graduate. And he's
right
over here. I'd like to introduce you to him.
I'd love to meet him. Thank you.
Okay, June, this is one of our success stories. This is Lee. Lee, this is June. She's going to
Hi.
ask you a couple of questions about rehab.
Okay.
How are you today?
Good. How are you?
You look like you're having fun.
Well, I'm working at it.
Well, tell me, what brought you to cardiac rehab?
Well, the reason I came here was that I went up to Philadelphia to have elective surgery,
Oh,
and this was back in August, and
You can stay
I got no further than the cardiac prep, and I wound up having a triple bypass.
oh my.
So the cardiac team at Penn suggested that I have come down here and then get involved with a cardiac rehab program, which that's how I came here.
I see. And are you enjoying it?
Well, today's my last day.
You're
So I'm
graduating.
graduating today, so it's kind of,
about that?
kind of an exciting event for me. But it's been very successful. I think that the people here that have done a very, very good job from the standpoint of moving you on to certainly a new lifestyle through education.
And that's a really important part of it, the education piece.
It is
Would
the
you agree?
education and the also not only the physical end of it, but also the mental end of it.
I see. How are you feeling?
I feel pretty good.
Really?
Yeah, I feel
That's
really good.
great. That's great. Well, you look certainly very fit, and
Well, I've lost a lot of weight. I lost 30 pounds.
wow. So,
not since coming here, but actually since having the surgery.
yeah.
But it's a complete different change in your lifestyle, and this is something that a lot of times everybody has to face. So you just have to pick it up and go on, and it's.
well, was it convenient for you having it here locally in
Yeah, it
Brunswick
really
County?
was. It's been convenient for me because of the fact that I live in Ocean Isle, so it's a
I
very
see.
short trip to come here,
Sure.
and I've met a lot of nice people here too.
Yeah, it seems like a great atmosphere here.
Well, it is, and it's kind of neat to come in here and see people who walk in here and have a very difficult time starting right from the beginning, but in a very short period of time progressing.
So today's your graduation. So
Yes.
what happens next?
Play golf.
Play golf.
I'll be able to get back into my golf group, which is, I usually play like probably 3 or 4 times a week. So I'm looking forward to getting back to a normal situation. I'm very fortunate. My wife's a nurse practitioner, so I have some nursing
yeah.
care at home.
Right.
So we're kind of looking forward to the holidays and getting back to a normal situation.
Sure. And I'm sure that this rehab has helped attain that for you.
Absolutely, it's excellent. I mean, I think it's one of the things that I think with a lot of people, I think their doctor tells them to go and do that, and they don't do it
And they
because they
don't.
don't know what to expect. But coming here was a real good, it was a very good experience.
Well, great. I'm happy to hear you say that, and I'm happy that you're doing so well.
Thank you.
Well, thank you so much for telling us your story, and we wish you all the best.
Thank you very much.
And happy golfing.
Thank you.
Okay, I understand you'd like to talk to somebody from physical therapy. That's another one of our rehab services.
Yeah, I would love to do
Come on
that.
over,
Is that
I'll introduce
possible?
you. Sure, come on over and I'll
Great.
introduce you. Hey, Tom.
Hey.
June, this is Tom Schoaf. Tom, this is
June.
June Baker.
Nice
She's
to meet
gonna
you,
ask
Miss
some
Baker.
Very
questions
nice to
about
meet
physical
you.
therapy.
Very nice to meet you.
Fantastic.
Thank you,
Sounds
Kim.
good.
You're welcome.
Well, tell me about yourself, Tom. Where do you come from?
Sure, you bet. Originally from High Point, Greensboro area.
Oh, yeah.
And been here for about 6 years now.
Really?
And working at Brunswick Hospital and in the physical therapy department.
And where'd you go to school?
Went to school, started at UNC Charlotte, and then went to Guilford Technical Community College in the physical therapy field.
Wow.
So just outside in Jamestown.
Yeah. You love living here at the beach?
We do. We came
That's
here
great.
to raise the family, and
Yeah,
just a
that's
great
great.
opportunity, beautiful area.
Well,
So
good.
this is where we came.
Good. Well, I'm here today to learn about physical therapy and what services you provide to our residents in Brunswick County. So tell me a little bit, what is physical therapy?
You bet. Physical therapy is an approach that we use to help folks either overcome injuries or if they've had things like strokes, any type setbacks that from a physical standpoint that they need help with. So whether it be knee replacements, shoulder replacements, back injuries, again, like we talked about, strokes, spinal cord injuries, anything that they really need us to help them get back to their normal activities of daily living.
And how does a patient get into physical therapy here at Brunswick?
It's real easy. We do require that a doctor see them
Okay.
first and have a prescription for physical therapy. So if they've been injured or whatever it is that they've gone through, if they just go to their physician, have a prescription filled out for physical therapy, they come on into the department and set up what's called an initial evaluation. And on the initial evaluation, they'll meet and we kind of go over things of their history, why they're coming, what their problem is, and then we kind of set it out step-by-step approach to get them from the state that they're currently in to a rehab state and feeling better and out the door. So real easy.
So you design the program then based on their needs or their issues. Then you design that program and then you guys report back to the doctor?
Exactly. What we do is the doctor will set up kind of the initial where he wants us to focus their treatment.
I see.
Sometimes it's a very specific focus. Sometimes it's pretty much a general focus. And from that point, we decide what's going to be best for the patient based on their diagnosis. Certain diagnoses will require them to come in a little bit more frequently, but anywhere from 2 to 3 times a week. And we set it up in a progressive state. And once they go through that treatment, we can also adjust as we go through the treatment, whether we need to add visits or take away visits. And then once, of course, they get to the healed state, then we discharge them. And a lot of times we set them up with a home exercise program, something that they can do at home that they kind of mimic what they've been doing here in a rehab standpoint and continue their care day after day for long term.
Well, I see you have a lot of equipment here. Let's talk about some types of physical therapy, if you could sort of walk me through what that looks like.
You bet, you bet. There's a lot of different things, and whether it's a shoulder problem that they're coming, whether they've had shoulder surgery, knee surgery, depending on what their diagnosis is, we've had all kinds of equipment that's going to help benefit them and getting return to their normal self, I guess. So, I mean, some of the things that we have a parallel bar that you kind of see right here. Parallel bars are really for folks that may have some balance issues or they're learning how to walk again, whether that been from, from a car wreck or from a stroke or brain injury or something that's occurred there. So this is pretty much a very low-level type therapy that's going to really help them get up and get walking, something that they have to use. You can see a couple different things. Our mats, of course, which is you'll see in every physical therapy department. And pretty much our mats, we have what's called high-low tables, and those are tables that are larger tables, and they raise and lower depending on if a patient can get up on a height or they need to be on a low bed.
Oh, that's convenient.
So it is. We have things like cold packs. We have hot packs. We have things called ultrasound, which is another piece of equipment that really helps to rehab them as well. So just lots of things. You'll see some balls around.
Yeah, I noticed some big balls in the corner there.
Yeah.
What would something like that be used for?
You bet. The physio ball, at one point
That's
in time,
what's called a physio ball?
It's called a physio ball,
Okay.
yeah. You can never find those ever. They pretty much was strictly in rehab departments and physical therapy departments. Now every department store in America has one. So basically, those are going to be used for certain strengthening type exercises. What they're really good for is core and abdominal strengthening. So if we have a patient that is weak in their core, we can teach them how to really kind of engage their core muscles or their muscles in the abdomen area and some of their side muscles. And that helps them to sit better, helps them to walk better. And if it's a patient that has back pain, then by engaging those core muscles can really help stabilize the spine and help to decrease their pain. So you can sit on them, you can lay on them.
I have heard that some folks will sit at their desk on the right size ball.
Yes, that's exactly right. In work and in school environments, we see a lot of folks starting to use the physio balls. The reason being is if you try to sit on a physio ball and you slouch, there's no way you're going to stay on that ball. You're going to be on the floor.
Oh, okay.
So by having them either at a work situation, at a workstation, it promotes a good sitting posture. So we don't get in this slump kind of posture that so many people are in. And of course, with kids, same thing. Keeps them awake. If you go to sleep on the ball, you're going to be on the floor.